I'm sorry. There's nothing I can say, Doc.
Some people are beyond help.
This is Dr. Thomas Romo, and he is the Director of Facial and Plastic Reconstructive Surgery at Lenox Hill Hospital, and you're also at the Manhattan Eye, Ear, and Throat Hospital.
Right down the street.
We are talking this morning about a new kind of brow lift. You say the brow lift of the past was all done wrong, out of sequence.
Well, a couple of things. When we age, the brow falls. It tends to make you look a little angry. The standard technique was to actually manage that by taking out the upper eyelid skin. And the alternative was to do a very aggressive brow lift. A newer brow lift, which is less invasive, is available today. No skin out, no hair out. And it should be done before you really have your eyelid skin taken out. Because you can end up with problems if you take the skin out first and then need a brow lift later on because you can't close your eyes.
You get that sort of stuck in
that
the
stare,
headlights, that deer
somewhat
look.
goosed look.
Right,
yeah,
right.
Absolutely.
Let's take a look at some slides that we have of your work, some before and afters. Now tell me a little bit about what's up here.
Okay, well, I mean, it's a side view, so you can actually see that what the brow is actually down, and what it does is it gives her this hooding or extra skin look. And what's been done, instead of taking out the eyelid skin, what we've done is raised the brow, brought her back
so
to a
you've
more...
gone up into the hairline.
Yeah, we've made some small incisions, and the procedure's done with an endoscope, and you don't take any hair out and any skin out today. And then you raise the brow up, and you fixate that brow with a dissolvable tack, and the brow grows into a higher level, but it gives you truly a more youthful look instead of the brow being down and then just having a little slit.
And you don't get that I'm staring at the world, that surprise
Exactly.
look.
This is done more exactingly. We use a caliper millimeter device, which we actually determine how much we want to elevate before and after surgery.
Let's take a look at another picture.
Another young lady, if you look at her, you can see that the brows have come down. It makes her look a little old, a little angry. If you took out her eyelid skin, her brows would still be down and she'd still be looking a little old. In this case, she's had an elevation of the brow that's been fixated. The brow is back up on top the bony rim, which is a youthful position.
It is
and
youthful.
She has no eyelid closure problems because she's not missing skin.
Okay, I want to quickly get to this next picture because there was a woman who came in and you said to her, you've had so much done now that I can't really do this surgery for you.
Exactly. Well, this is another before and after, and she's actually had another one. You can see she's got this, the brows are down. If you just took out her eyelid skin, again, she would have that angry looking brow. Now, this is a woman who came in who had already had her eyelids done, and what we did is we raised her brow, and when we did, she couldn't close her eyes. So the sequence was done wrong. She should have had the brows elevated first, and then a little bit of skin taken out. Today, we don't want to take out eyelid skin in patients.
Okay. Dr. Thomas Romo, we want to thank you very much. Oh, how much?
How much? It runs about anywhere from $3,500 to $4,500.
Will you give him a discount? That's a lot cheaper than I thought, actually.
Always give a discount to the people who really need it.
Okay, Dave. Dave has an angry brow. Dr. Thomas Romo, we thank you so very much for being with us today. Very interesting. Very interesting. Okay.
Cheryl.